IG-SRT has honestly been very helpful, especially during this time of the pandemic. We've been able to continue to treat patients despite reducing our patient load in the office significantly. And I've kind of explained this to other people. IG-SRT has been almost a lifeline for us to allow us to continue to have some revenue despite the drop in patient load here at the office.
They are coming in 3 times a week for up to 5 weeks, but it's a quick in and out appointment. We actually were able, even during the quarantine, to resume treatment of our skin cancer patients who were undergoing therapy. And the way we were able to safely offer that is we just have a separate entrance. Those patients came in. It was very private, very individualized. And so patients who were even elderly and some immune compromised still felt confident coming in to have their cancers treated and cured because they were having good results. They didn't want to lose the benefit. So even through a crisis such as COVID quarantine, we were still able to continue caring for our cancer patients and cure their malignancies.
It has certainly been beneficial to us. Of course, like most other states in the country, we did have a lag when we're at the height of the pandemic, but it certainly provided a way of treating patients and not necessarily putting them at higher risk of getting a secondary infection that for some patients may presuppose them, at least in their eyes, in terms of getting the virus. I don't think that's the case, but patients were very reticent about having these surgical procedures at the height of the pandemic. So the IG-SRT sort of fit the bill in that regard.
I think our numbers of patients going through the program have maintained throughout COVID treatment, which is very surprising. I think we all thought it would go down, but it didn't. It is maintained. And Josh has his own schedule. Our therapist has his own schedule. So his waiting room is constantly turning over separate from ours. So his patients, as soon as they walk in, Josh has the room cleaned and ready to bring them back. So it hasn't impacted our waiting room or our business in any negative way at all.
I think that the SRT for us during COVID has been just kind of status quo. It's easy to make sure there's not a lot of touch points. There's no instruments really to have to autoclave or open wounds to have to dress and take care of. And the appointments are so quick, that really is just a couple minutes of the patient's day. So we're able to get patients efficiently and effectively treated and then sent to go home, hopefully.